بسم الله الرحمن الرحيم الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلل فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي السلام عليكم ورحمة الله وبركاته. Welcome to our webinar on the fiqh of fasting, or medical fiqh of fasting. And inshallah, what I'm going to do is I will talk about 4 particular subject areas. And I really want this to be quite interactive. So yeah, it's a webinar. And I don't want it to be like a lecture. So if there's any particular questions people have related to these particular topics, and if I can answer them, then inshallah I will try to respond the best way I know to address some of those important questions. So the session is in particularly regarding medical fiqh of fasting. So it's more related to medical type questions related to the subject of fasting. So what we will talk about is rulings of fasting from the Quran and Hadith. Yeah, what do they mean? So there's something about that. Then there's something about who is fasting obligatory for, and what kind of people are excused from fasting. So what are the the exceptional conditions for people to fast, not fast, sorry. Then we need to talk a bit about safe fasting. So yes, medical questions, this is where my sort of medical cap comes on as a doctor. Advice regarding how do I manage certain conditions like diabetes or asthma or COPD, bronchitis, or any other particular illnesses, or even pregnancy and things like that. Okay, so I will answer your questions related to that. And then finally, invalidators of fasting. What things invalidate your fast? What particular procedures invalidate your fast? What ways of administering medication invalidate your fast? Or investigations or anything like that. Okay, so this is your time, your opportunity to ask away as much as you want, inshallah, and I'll try to address and answer your questions in the limited time that we have, which is about an hour or less than an hour now. So inshallah, let's begin. Let's talk about rules of fasting. So think of these slides as just a basis of discussion rather than, a lecture type sort of format. Okay, so we know there are verses of the Quran where Allah subhanahu wa ta'ala has clearly recognized and told us that there are certain exceptions. Yeah, even though there's a very clear statement in the Quran, يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. Okay, so fasting is prescribed for you as it was prescribed for those before you, so that you may learn self-respect. So you become God conscious. What is taqwa? Taqwa is a high state of ihsan. We try to achieve a high state of ihsan. أن تعبد الله كأنه يرى, or أن تعبد الله كأنك ترى, that you worship Allah like you see Him. وإن لم تكن تراك إنه يراك, and if you cannot see Him, He sees you. Okay, so in that state, you are trying to reach a very high state of being conscious of Allah in everything. Then Allah says, أيام معدودات فمن كان منكم مريضا أو على سفر فعدة من أيام أخرى. Fast the prescribed number of days, except if any of you is ill or on a journey, then let him fast a similar number of days later. Yai to do qada of those fasts. For those who cannot endure it for medical reasons, for example. وَعَلَى الَّذِينَ يُطِيقُونَهُ فِدْيَةٌ طَعَامُ مَسْكِينٍ. Yeah. So, in other words, for those who can't endure it, there is a ransom, and that is feeding of one poor person for each mistake. But if he feeds more of his own free will, it was better for him. However, if you truly understand the rationale of fasting, it is better for you to fast. Because it is better for him. وَأَن تَصُومُوا خَيْرٌ لَكُمْ, and to fast is better for you. If you knew, if only you, in kuntum ta'lamun. Okay, so you should try to fast as much as you can. And if you are compelled not to because of your illness or your state, frailty, etc., then you are excused. Okay. Right. So, and there are many other verses that give the same kind of message. Right. We know all about fasting, the basic understanding of suhoor and iftar and various other things. So I don't need to go through that particular slide. It's quite straightforward. This is an interesting slide, but people want to ask about questions like this. Who is exempt from fasting? So this is just a general principled approach as general rules. So children under 12 years of age are excused and under the age of puberty. Now, 12 years is an arbitrary age. What it really means is there needs to be a sense of maturity and understanding about the rules of fasting for a child to fast. And they are held accountable for not fasting once they reach bulugh, puberty. Okay, so pubertness or puberty for females occurs when they begin hayd, menstruating. For men, or for boys, puberty would be at the time where they would have what we 𝗕𝗹𝗵, so where they have a wet dream, for example. Okay, or they reach an age of maturity, and that varies. Usually, it's taken as 15 years. So if they don't have any signs of puberty, but they have reached the age of 15, that point is considered. And this is lunar years, by the way, not Gregorian years, yeah, in sense of the sort of solar years. It's lunar years. Okay. So in other words, you're looking at 14 and a half years, or even younger than that. Yeah, they are basically considered as bulugh. So the question arises that you should really be encouraging them to fast even before that time. And, 10 years even, that's the time when you should really get them to fast the whole month of Ramadan. So by the time they reach 12 years or, older until they reach puberty, then during that time, they're able to fast quite comfortably because they are quite accustomed to fasting. Don't make it the first time they've ever had a Ramadan, full month of fasting, because that would be quite exceptional for them. Rather slowly build them up in that sense. Don't get young kids to fast. Some kids are very, very keen. They want to fast. Sometimes, it's out of our control. They insist on it. That's fine. But, don't consider that as a shari fast. You can compromise in the, drinking water here and there and things like that. Slowly building them up. The next group of people are people who are incapable of fasting due to physical weakness. Yeah. So they are acutely unwell. They are frail or elderly. They are frail, they're elderly, they won't be able to manage a fast. They'll feel very weak. They have a chest infection, for example, or they had a urine infection or something along those lines, a flu, and they are really struggling. Okay. Then you have the terminal illness patients, people who are terminally unwell. So these are patients who would never be able to fast again, probably. Okay, and for them there is a fidya. We'll talk about fidya later on. Okay, whereas the others, they would have to do qada. Similarly, a frail elderly person, they are terminal in a kind of a way. So for them, there'll be fidya as well. Chronic diseases such as diabetes, COPD, these patients will be required to offer fidya as well if it's a chronic condition right till until their death. And they struggle when they fast, immensely struggle when they fast, so they are excused. Other than that, even if you've got a chronic illness, and you're capable of fasting, you should be fasting. Okay. Mental illness or learning impaired. So mental illness or learning impaired is a state of junoon or ata, yeah, a state of sort of not having full comprehension and cognitive capacity, they have poor insight, poor understanding, they would be excused during that period of junoon or in somebody who has a mental illness. And the others, i.e., who have a learning disability or are quite severe mentally impaired cognitively because of the, I don't know, autism maybe, those kids would be excused if it's quite severe and they really don't understand what fasting is all about and the rulings of fasting. Then they'll be excused. Another group is pregnant or breastfeeding women. Now, pregnant and breastfeeding women by default are not excused. And that's an important point to make. They are only excused if they are at risk of becoming unwell, or they are a risk to themselves and their unborn child. Okay, so if there's a risk to them that they could suffer from fasting, then they are excused and they would have to do qada and make up for that fast. Menstruating women, in particular the Hanafi madhab and many other madhahib, are excused as well. Menstruating women or women with postpartum bleeding, nifas or haid, they are also excused from fasting. They should not be fasting because they are not in the state of tahara. And they will also be excused, and they should be making up for those fasts. They should be doing qada. Okay. And then the final thing is those who are suffering. So they are considered as a musafir. Anybody who's considered as a musafir, they are exempt from fasting, though they should fast ideally if they can, but they're exempt generally overall. Default position, exemption, but many of them decide to fast because it's a very valuable month, and people don't want to lose the blessing of that fast. So for that reason, it's encouraged to fast even in that situation, unless there is quite a lot of hardship, and then you would be excused. Okay. Right. Any questions, anybody? Do madhahib, so Mary's asking, do different madhahib have different rules on fasting or missing fasting due to illness? Reality is that they all make the same statements regarding illnesses and fasting. So in essence, and I'll talk about what they are in a short while. So yeah, they do agree in essence. So Durat is asking, mental illness, as he mentioned, autism severe case should be clarified, please. What does severe mean? And do other mental illnesses that include depression, ADHD, etc. count? Okay, good question. And I will cover that in terms of what I mean by severe. Okay, so I will go over that. There's a slide related to that, inshallah. Okay, there's a couple of people asking in chat. What if you are receiving treatment via dialysis? We will talk about that later on in a short while. A separate topic. But yeah, somebody who's on dialysis, really, they are quite unwell, aren't they? So they really should not be fasting. But end-stage kidney failure should be fasting. Migraine. Okay, migraine. Okay, migraine depends again, severity of migraine. I will talk about severity in another slide, inshallah. So we'll come back to that. Somebody's asking, my daughter has eating disorder, so if she fasts, she will lose more to the point that is dangerous for her. According to a doctor, is this all right if she missed fasting? So if she has anorexia, and it's a diagnosed condition of anorexia, and clearly she has considerably lost a lot of weight, she would be excused because she has, clearly a medical condition that's problematic. So she would be excused, yes. Another question asking, what about children who have reached puberty, but they weren't taught about the obligation of fasting, so they missed fast for multiple years? Ignorance, unfortunately, is not an excuse. So if knowledge wasn't there, it was the responsibility of the parents to ensure that they gain that knowledge, but they are still held liable. So they would have to make up for those fasts. Okay? And we'll talk about the difference between qada and kafara later on as well, inshallah. Okay, auntie has diabetes and Alzheimer's, but she really is keen on wanting to fast, but she gets ill a day or two after. Is she still able to? Well, can you compel her to stay away from fasting? If she refuses to eat, I don't think there's much you can do about that. But generally speaking, if you find that she's getting very unwell by fasting, she's getting very weak, then you should discourage her from fasting. She's not held liable for it. Yeah. If she does fast, then alhamdulillah, as long as she's not getting unwell and weak with it. So about the anorexia, can she pay fidya or have to try to replace fast? No, because anorexia is not a chronic condition. Yeah, they do come out of it. It's a very serious condition. It can last for quite a number of years, sometimes in some, kids or young adults and adolescents. But it's not a chronic condition. She would have to make up for those fasts later on. So Cindy's asking, what if you need to take pills at several different times of the day? So that's about taking medication. Depends how serious those medications are and how necessary it is for you to take it through the daytime. Most pills usually are either, once a day, twice a day, 3 times a day. Very few are 4 times a day. 3 times a day can be a bit problematic, but it depends on how serious your condition is. Antibiotics sometimes are given 3 times a day. I would recommend that if you can, especially depending on what part of the world you're in the UK at the moment, you can take things 3 times a day and fast. Yeah, because you can take out a suhoor time, you can take out iftari time, and you can take it at time you go to sleep. So it's quite spread out because the days are short. Other countries where clearly the days are long, then it's difficult. You need to then question whether you can take a double dose, let's say iftari time, and take a single dose in the morning, suhoor, and make up for it that way during the month of Ramadan. So it really depends in each individual case. If it's absolute necessary, then you need to look at the condition. If you didn't take it like that, what would happen? And if clearly there's no real serious repercussions, then you should still not be taking it during the fasting period. Okay, right. Okay, so I think I've answered most of those questions. Okay, that's one particular topic. Okay, we've got another. Oh, we've got a few more. Right, okay. One time I'm going to have to stop because otherwise we will get to go through some of the other things. But inshallah, I'll try to answer as many as I can. Uh, what about if someone has kidney stones? Kidney stones is intermittent. You get intermittent pains, which are very severe. So ideally with kidney stones, you should be drinking plenty of fluids during the days anyway. But if you are having a day where you are having severe pain and you can't manage it and you need to take pain relief, then you will be excused to take it and then break your fast and then do qada of that day. But other than that, you should just fast. Somebody's got a very sensitive question. Severity of a condition, say mental, and the presence of honesty is a very fragile thing to calculate. I find myself questioning my sincerity towards fasting, but simultaneously I'm unable to do anything while fasting ibadah due to ADHD and pressures from college and home. What do you suggest? ADHD, interesting condition. ADHD is more hyperactivity and various things like that. It's not a condition that affects cognition severely to the degree where you will lose your 𝗕liya. So for that particular perspective, it's a very difficult one to justify as an excuse not to fast. If ADHD is affecting somebody's cognition on the 𝗕liya, their ability to understand the rulings, then yes, but there's very little, if any, evidence to suggest that ADHD individuals actually lose their cognition or they have very diminished cognition, but rather it's more of a behavioral thing due to the hyperactivity and focus and concentration and things like that are affected. For loss of focus and concentration is not necessarily an excuse for fasting. It's only if it's a chronic permanent state of loss of focus and concentration and then an inability to comprehend the rulings that it becomes problematic. If the person is impulsive and feels that they have to eat, that is not necessarily ADHD. That sounds like some kind of behavioral issue. Yeah, so that's a separate issue. So ADHD, very challenging to justify somebody not to fast with ADHD, I think, anyway. Yeah, but individual cases should be looked at separately, depending how severe that case is. This session is being recorded. Yeah, alhamdulillah, it's being recorded. Okay, we've got one or two more questions. Okay, that's fine. We've answered most of those questions, alhamdulillah. Okay. Right. Right, let's move on. Let's go on to the next bit. Right. This is an important discussion. Okay, people misunderstand this. What is qada? What is kafara, etc.? What is fidya? So what is qada? Qada is that you make up for a missed fast of the month of Ramadan. That's it. Not of any other month, not a voluntary fast or anything. Just a month of Ramadan fast. Okay, you make up for it. Because they are obligatory fasts. And if you don't do them, you need to make up. So at any time you are able to make up the qada fast outside Ramadan, you should make it up. Okay, and for the fast that you missed. So yeah, and that is necessary. You have to do it. You have to make up for that fast. Okay, so that's a straightforward concept. What is fidya? Fidya is an atonement. Fidya is only for those individuals who cannot make up for qada any time in their life because of the state of the permanence of their condition. Their condition is chronic, there is permanently unwell, out of frailty, elderly, frail individuals, for example, people with chronic illnesses like severe diabetes, severe chronic kidney disease, severe bronchitis, for example, who they can't make up for that. Then they give fidya. Okay. And fidya, you need to talk to your local imam because it does vary in the amount that you would have to pay per fasting day. Okay, so there's like an amount per fasting day. Usually it can vary from a couple of pounds, i.e. in the UK, but that varies depending on what currency you're using, recognizing we've got an audience from all over the world. So I would go to your local imam and find out what your local fidya is, or go on a regular website that you trust regarding what your fidya amount is. Now, if you are in a country like the UK, and you know that when the days are short, like they are during winter, you are able to manage a fast, then it's not permissible for you to give fidya. You have to do qada in the shorter days, i.e. winter months. You make up for your Ramadan fast in the winter months where there's the shorter days. Okay, then you have to do that. What is kafara? Expiation. Kafara is compensation that you pay by deliberately breaking a fast in the month of Ramadan without a valid reason. So there are certain rules of kafara. Kafara is that you fast 60 consecutive days. You can't miss a day. You have to fast for 60 days consecutively. And it's a form of expiation for a crime that you've committed. And that is you have intentionally broken your fast with food and water, or food and liquids. Yeah. And that's it. So if you intentionally break your fast, so you have, number one, first condition, you have broken your fast. Number two, it has to be with food, things that are considered as food or drink. Okay, not medication. You take medication is tadawi. Yeah, it's not food. So you don't do kafara if you have taken and broken your fast with medication. Even if that medication wasn't justified. You took paracetamol, even though your head was mild and you should really have taken paracetamol. Even then, it's not kafara, because that's not food and drink. Okay, so they're the two main things. So let's say you woke up one morning and you thought, I'm ill, I'm not going to fast. Then that's not a kafara. It's you have to break the fast. So in other words, you've gone through the day and you're not excused and you just break the fast with food and water. Yeah, that is kafara. Okay, so hopefully that makes sense of what kafara is. For menstruating women that are trying to do kafara, they're doing it for 60 days and they're thinking, oh my goodness, I am menstruating now, so I can't fast now. And I'm in the middle of my 60 days. Do I need? So for them, they just go through the period of haid, not fast, and then carry on the remaining part of their 60 days. Okay, so that time period is excused because it's, most women, they menstruate in the time of 60 days. So clearly they're excused during that period. Then they carry on fasting after that and make up for the remaining 60 days. Hopefully that makes sense, inshallah. Yes, everybody clear about that? Okay, let's have a look. Should one fast with a burnout, exhausted adrenal glands, hypothyroidism, and muscle pain? Need to assess that. It's very sort of vague what you're saying there. So you need to probably talk to your doctor. Yeah. Okay, in that sense. Okay. Because that's quite a vague sort of diagnosis to judge. Right, safe fasting, limited time. So we're just going to quickly go through a couple of things. These are a couple of questions that sometimes we can ask. We'll address them. I'm going to go through this quite quickly because I just really want to focus on the common questions that we get, really, rather than go on things that are probably beyond the topic. But these are common questions. Patient who suffers from asthma and hay fever. Yeah, right. What principles do you use to decide whether they should fast or not? Yeah. Frail elderly woman, let's say, what kind of, would she be exempt? Young man with severe back pain, yeah, would they be exempt? A woman recently delivered and suffering from depression, would she be exempt? A young boy sitting for their exams, serious important exams, would they be exempt? A diabetic patient on insulin, would they be exempt? So these are, really interesting questions. And they're quite common questions. Okay, so we will try to address those questions. Somebody's asking the question about explaining the ruling about breaking the fast in case of starting menstruating during the day. So I heard that you cannot break the fast if periods start after Asr, etc. Look, if your period has started and you have noticed a bleed during Asr Salah, for example, right? That immediately means your fast of that day is invalid. Okay. If it starts after Maghrib Salah, then that whole day is valid. Okay. And that's the general rule. Okay. Simple. Okay. Let's go back here. I say there is a four principle approach, but I'm going to simplify that even further and say there actually is two things to consider here. Right. Number one, physical harm. Number two, mental harm. Okay, those are two things that are excused. Physical harm. Physical harm to that degree of seriousness that a person cannot function. What does that mean? That you are not able to carry out your normal daily relevant and important chores that you are dependent on, like going to the bathroom, general hygiene. You're not able to do that out of weakness. Yeah. Going downstairs and having something to eat. You're not able to do those things out of weakness, severe weakness. In a kind of way, you're bedridden. You're having to be in bed. Then you are excused. Those are physical symptoms. You are excused. Mental symptoms, that you are undergoing severe depression, negative thoughts, not able to get out of bed. You're struggling. You're not able to carry out your daily chores. Right? Those, again, are excused. Yeah, those individuals are excused. If they're able to do those things, if they're able to go to use the bathroom themselves, they're able to even cook for themselves, make food for themselves, eat for themselves, and do the sort of regular daily things that they can do, the core daily things are important, they're able to do them, then they are not excused except for these four principal approaches that you need to think about. Okay? So that's the first point. What is that? The first one is worsening physical condition. If you find that if you do fast So you can do those things, but if you do fast, your condition is going to worsen. How do you know that? Through one very important way, tajriba, experience. I fasted last time when I was in this condition, and I was very unwell when I fasted. So that's your personal experience. Or tajriba in the sense of what the doctors have told you or clinicians have told you, that you should not be fasting in this particular state. And they have to be 𝗕𝗵𝗆 who are Muslims, ideally, people who have a real understanding of the importance of fasting. And they're not just liberal on this issue. Then if they say, look, you should not be fasting, it's a risk, then you are excused. So let's say you end up with a chest infection and you're not that severely unwell. You're taking antibiotics, it's helping. You're not that severely unwell, but you know that if I fast, I'm going to deteriorate. I'm going to get worse. My infection's going to get worse, and there's going to be slower recovery because of it. The even slower recovery would be excused for you from fasting. So you got chest infection, you start fasting, you're not getting worse, but you're going to have a slower recovery. It's going to last longer and it's going to be more problematic. Then you will be excused. So that's a second point. The third is worsening mental condition. So you know that, I don't feel too bad. I feel quite depressed, and so forth at this stage, but I don't feel too bad. But I know if I start fasting, I have, experienced that my condition worsens, right? Then you are excused. And worsening pain as well. So yeah, my pain is severe, but it's not significant enough, that, I'm not able to do my core duties. I've got severe back pain. But you know that if you don't take pain relief, your pain will become worse and you will not be able to do the things that you want to do. So this is all about your experience. That's why it's always important to try to fast during the month of Sha'ban, the month that we're in now, and trial fast to see. And then if you find that you become very unwell with it, you can break it. And it's not any sense of guilt. And then with that tajriba, with that experience, that you cannot fast the month of Ramadan. Then, if you can do it later on, you make qada. Or if clearly it's a chronic condition and you're not going to get better, then you give fidya. Okay? Hopefully that makes sense in address to some of those questions that people asked before. So the whole point is you're unable to physically, mentally perform normal and important daily chores. Either now or if you fast, it will be a trajectory towards that. Then you are excused. Okay, so hopefully that makes sense. Yeah, any questions around that, then I'm happy to answer them. I'm trying to answer your questions in the statements I'm making already, but clearly sometimes, it's not always addressing everything. Mart is asking, how about new reverts and kafara? I am a revert to Islam and it will be my first Ramadan. I have poor self-control when it comes to food and I am incredibly worried that I will break the fast intentionally even if I try to my best. Islam is very strict about fasting. Yeah. If you are unwell and sick and you fall into this category of conditions that I've already explained, then you will be excused. Otherwise, you will not be excused. Otherwise, you will not be excused. So ideally, this is a good month, Sha'ban, to work up to it. Yeah, everyone who is not unwell and are healthy, in mentally and physically, should be able to fast. لا يكلف الله نفسا إلا وسعها. Number one, nobody is compelled in Islam. Yes, but there is also a very important thing. يريد الله بكم اليسر ولا يريد بكم العسر. Allah does not intend hardship on you, but yet these things that are mentioned here, they are not supposed to be severe hardship on people, right? So, a healthy person should not be compelled to eat and drink. It's your will that you need to work on. It's a spiritual issue. It's not a physical issue. And that's the important thing. It's a spiritual issue. And I would say that fasting in Ramadan is in particular going to be of immense benefit for you, if that's your state. Probably more than an average person, because of that reason. So I would highly recommend you carry on with your fast. Yeah, and you'll find it very beneficial once you get through that stage. So then somebody's asking, surprisingly, my family members who are also new Muslims and some not even Muslim found it easy to fast during Ramadan. Yeah, completely. It's a perception. It really is. Ramadan fasting is not a burden. It really is not. It's a perception. Oh no, I have to abstain from food and drink. It's not. If you are truly, spiritually connected in Ramadan, you will not even feel. And then your body accommodates it. Your body gets used to it. It recognizes that you are going to break your fast at iftar, and then you don't feel as hungry as you do in those times. Okay, and may Allah subhanahu wa ta'ala make it easy for you. Indeed, inshallah, Allah make it easy for all of us. Inshallah. Okay. Right. Hardship. Good point. Hardship. It's going to get a bit technical. I am going to avoid this for the moment, but I will come back to this later on, inshallah. But I'll just very briefly mention the weakness due to fasting must be a real cause and real risk leading to these. Physical, mental harm to self, medical, legal reasons. This is talking about people who are working in the medical field. So it's very specific to them. So I'm going to avoid it for the moment. But yeah, this is important. A lot of people, they decide to fast or not fast based on their own personal predicaments. Yeah. I.e. how religious they are. Or they do it because of religion, or they do it because of medical reasons. So there are a number of reasons why people decide not to fast. As long as they are valid, then inshallah that's something to think about. Okay. Okay. This is going to be answered anyway because we're talking about patient who suffers from asthma and hay fever. If they're using inhalers, that will invalidate their fast. We'll talk a bit about that later on. So if they're compelled to take an inhaler at that time, it will invalidate their fast. They'd have to make up. They have to do qada of that fast. Frail elderly woman, again, you need to measure how frail she is, and if she starts fasting, she's going to become really weak, and she's going to deteriorate. Then she's excused. Young man with severe back pain, same thing. If they fast and and the pain becomes so severe, they're likely to end up, dysfunctional in terms of core duties. Then they're excused. Woman recently delivered and suffering from depression. Again, depends on the severity of that depression. If that depression is so severe that if she starts fasting, it'll worsen and she'll be left to bedridden situation, then she's excused. A young boy sitting for GCSE exams, not excused because our 𝗕𝗹𝗆 𝗪 the hereafter is better than the dunya and it is eternal. And fasting is something which is fard, and for that reason, you must fast. You just mitigate it as much as you can. Get good night's sleep. Make sure you have good, healthy food, as suhoor, etc., and, you must fast. A diabetic patient on insulin, depending how severe the diabetes is, whether they're insulin dependent, then they would be excused. Otherwise, they should be fasting. Yeah, even diabetics should be fasting unless they are excused. This is a nice little scale that explains it in very, very simple terms. I'm going to just quickly go over this. Very high risk diabetics, high risk diabetics, moderate low risk diabetics. Very high risk diabetics are people who are type 1 diabetic, right? And they are taking insulin and that's it. Okay. Or they've had a DKA episode, i.e. diabetic ketoacidosis. They become so acidotic because the blood sugar has gone so high, the ketones in the urine gone so high, they've ended up in hospital and they've had one of those episodes. They are very high risk. They should not be fasting. Yeah. وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى تَهْلُكَ. Do not take your own hands to your own destruction. Yeah. So you should not be fasting. High risk patients, they are usually patients who have good control, but they're type 1 diabetic. But ideally, they should really balance their risk. They should not ideally be fasting. If they do decide to fast, they need very good advice about it, and they are being very, compliant. Yeah. Type 2 diabetics with poor control who are on insulin, or if they've had a risk of hypos, then these kind of individuals, let's say, for example, you were fasting, you discovered your blood sugar gone down, or you felt really weak and you can't feel that you can continue with your fast, then break your fast at that moment. Break your fast if you are quite very weak, or you're hypo, your blood sugars are dropped, break your fast. And when you do that, then eat the minimum that you need to eat, consume, or drink for the rest of the day to keep yourself fit enough, and do qada of that fast. It doesn't mean that you start having big meals, because you still maintain the ethics of Ramadan. Okay, that's the important thing. And then you got the moderate low risk. These are type 2 diabetics, well controlled. They can fast. A lot of them can fast, unless there are risks of hypo, etc. That's a bit medically related, but anyway, we'll just skip this for the moment. Okay, you got other conditions as well. So you got patients who got severe bronchitis, emphysema, severe asthma. You got people who have heart disease, severe heart disease, coronary artery disease, get angina regularly. They have, shortness of breath if they walk distances. Chronic renal disease patients, people on renal dialysis. They've had a kidney transplant recently. They've got nephrotic syndrome, or any of those kind of severe kidney diseases. Yeah, immunocompromised patients who are on immunosuppressants, on steroids, for high dose steroids because of the underlying autoimmune condition, a rheumatological condition, whatever they may have, that's severe enough, they're excused. Chronic severe mental illnesses, severe depression and psychosis, those schizophrenics, people like that, they would be excused. Acute illnesses like asthma and an exacerbation like chest infection, severe flu, you would be excused. The conditions. I've already stipulated the conditions about the severity element. So those kind of individuals would be excused from this. Okay. Right. Yeah, so there are, come min sa'imin, there's a hadith, there are hadith related to, there are those who fast and gain nothing but except hunger. Yeah. Um, I just did a little talk about this just earlier today, and I'll try to sum it up. It's a very important question, even though it's not really directly fiqh related. But let's just say Imam Ghazali says there are 3 levels of people who fast. The first group are people who just fast, and all they do is abstain from food and drink. Some of them, they've continued, they do their faraid, i.e. they read the fard salah, and that's about it. They don't read Quran, they don't do any form of ibadah or anything like that. He categorizes them and says that these are the majority of people. Even some of them read Quran and so forth, and that's reality is majority of us. He calls them the umum. They are the umum. Those kind of individuals, they need to be thinking about going to level 2 at least. The second level is what he says khusus. They are specific group of people. They are sort of elite to some degree. They don't just fast their body, they fast their ruh, their soul. How do they fast their soul? They abstain from anything in terms of gaze that is haram, listening to things that are haram, speaking haram. So they control their tongue. Okay, so their fasting is fasting their tongue, fasting their ears, fasting their vision, in terms of abstaining from seeing things that are considered as haram. So they are very conscious of that. Okay, so this again is a means of controlling their sensory perceptors, and controlling their tongue. So abstaining from lying, abstaining from ghibah, backbiting, tail bearing, and all that kind of thing, and lying and so forth. So they abstain from that. So these are the second category. They call the khusus. Then he says that they're the khusus min khusus, the khusus of khusus. They are the elite of the elite, and they fast their thoughts. What that means is they don't entertain any kind of thought other than Islamic thoughts that relate and connect with Allah. They have no connection with the dunya. They're not involved in any worldly pursuits during the month of Ramadan. All they are focused on is Quran, Allah and His Rasul sallallahu alaihi wasallam. They are virtually in the state of i'tikaf throughout the whole month of Ramadan. Okay, and those individuals, he says, are the khusus min khusus. Okay, so in that sense, you want to be of at least the second category. Don't be just floating around the first category of people, which are the majority. work towards the second and third category, inshallah. And the last 10 days of Ramadan, are really useful because people do i'tikaf. Men go to your local masjid, do i'tikaf there. Women do i'tikaf in your own home. Find a particular secluded area in your home where you have little contact with people and do i'tikaf there. And it's very, very beneficial. Very, very beneficial. Okay, what invalidates fasts? Okay, let's have a very quick look at this. I'm just going to briefly explain the process and then I'll answer the questions. I think that's the easiest way to do it. Things that break the fast. There are qualified cavities. Okay, these cavities are called al-jawf-al-mu'tabar. What are the qualified cavities? Your throat, I would say after your tonsils, down, right down your gullet, your stomach, right down to your intestine, above your rectum, just above your rectum. Yeah, which means the bottom end of your rectum is excused, but above that, just above that, all that tract is your gastrointestinal tract. All that, anything that enters that will invalidate your fast. Anything that enters that will invalidate your fast. Okay, so they are jawf al-mu'tabar. Next is the qualified agent. So the thing what is it that you're passing? So anything, be it solid, be it liquid, yeah, or even vapor, that is discernible, that you can see and you can visualize, like white vapor everywhere, yeah, and it's very clear. If that enters any of these qualified cavities, right, it will invalidate your fast. It doesn't have to be food. It doesn't have to just be drink. It can be solids. It can be, lead, bits of lead. It can be anything that you're consuming. Anything that you put in your mouth and you swallow it will invalidate your fast, right? So in other words, even because it goes all the way down to your bottom end, right, to your rectal area, you put a suppository up there which clearly goes beyond your rectum, then even that will invalidate your fast. And this is agreed upon all the madhahib. Okay. Then you have manfaz al-mu'tabar. Manfaz al-mu'tabar means that there has to be some kind of patent duct or a passage, yeah, a qualified passage that leads from the external part of your body to the jawf al-mu'tabar. Either it goes straight into the jawf al-mu'tabar or there is some kind of passage that is made that goes into the jawf al-mu'tabar. This can be a natural passage in your body, like the throat, your mouth that goes to your throat. Okay, that's a natural passage. Or it can be induced and artificially made. So if I put a tube into your stomach lining, your skin, into your stomach, right into your stomach, and feed you through a peg feed or gastrostomy tube, then that is a man-made passage, and that will qualify as well. Okay, so natural or induced or put in there by surgical means, all those means would invalidate your fast. Okay, so those are the important things that you need to recognize. There's a discussion about process. I'm not going to go into too much detail there, but it's important. The other thing is absorbing states. There are certain states that you may be in, like for example, you are sleeping. Yeah. Okay. So you are sleeping. You're not conscious of it. Or absorbing states, like for example, forgetfulness. So even if that happened and you did it out of forgetfulness, then you would be excused. Okay. But things like making a mistake or accidental, you will not be excused. So there are absorbing states. We'll talk a bit about that as well. So very quickly, let's quickly go through. Let's skip these because that's just what I've talked about. We'll just talk about some of the absolving states. So forgetfulness is an absolving state. Hardship, arduousness, like there's fumes everywhere. Like you've had a shower, there's fumes everywhere. You would be excused there, even if they go into your mouth and your nose and through down your throat. Like vapors and dust and saliva, you're swallowing your saliva, you're excused, though it's disliked that you intentionally keep swallowing your saliva, especially after doing wudu and then swallowing your saliva. But they are arduous states, so you are excused from them. Necessity, so out of necessity. So for example, you're feeling unwell, you've got an asthma attack, you're wheezing now, you need an inhaler. That's necessity. That does not excuse you from your fast will be invalidated. In other words, it doesn't excuse you from not being invalidated, right? Ignorance, oh, I didn't know, oh, I've just found out now. That's still, it will still invalidate your fast. Accidental, you were gargling with water, or not gargling, you were rinsing your mouth with during wudu, and it accidentally went there because you're intending to do that, i.e., to rinse your mouth, but it accidentally went down your throat, and it's a small amount, but it accidentally went down your throat, that will invalidate your fast. So you need to be cautious. Yeah. Coercion is somebody holds you down and puts food into your mouth, it will still invalidate your fast. Okay. Sleep, unconsciousness, doesn't matter, even in the state of sleep, it will still invalidate your fast in those particular states. Okay. So if all those things are in place, then a person invalidates the fast. So we'll just finish on this slide, inshallah. And I'll go through this slide. And if you have any questions, do ask. Okay. So skin, acupuncture. So injections and things like skin, creams, lotions, deodorants. No, they don't. Yeah, but they penetrate the skin, don't they? And they go into the bloodstream. Some of them creams, like non-steroidal creams, and even HRT type creams and things like that. Even then, it won't invalidate your fast. Why? Because there's no patent duct or passage from the skin that goes straight into the gut, or even the blood system, to cause that directly. It's not direct, it's through absorption, so that it wouldn't. Okay, gastrostomy, peg tubes, we talked about that earlier. Somebody introduces a tube into your stomach externally, straight into your stomach, and feeds you through that way. That tube has now become that 𝗪𝗲𝗇𝗵, the passage, so that will invalidate your fast. Injections, fluids, injections generally, injections into your joints, intramuscular injections into your muscle, vaccinations, and things like that. Majority of the scholars say it does not invalidate your fast. That's the majority opinion. Okay, some say it does, but that's a minority opinion. Most say it doesn't. So I would take the no, unless you know for sure that the scholar that you're following, or scholars you're following, says yes. Okay, so there is a difference of opinion about IV fluids. We'll talk about that later on in a second. Patches, putting patches on, hormone therapy patches, contraceptive patches, things like that, does not, or even pain patches, fentanyl and things like that, does not invalidate your fast, again, because of that same reason. No patent passage into your gut. Okay. Ear, nose, throat, probably the most challenging one. Inhalers and nebulizers, difference of opinion. Majority opinion, it does invalidate your fast. There is a minority opinion, it doesn't. In fact, that was a predominant opinion, but now it's less so. And the reason why that is because when you are inhaling and taking, vapor, visible vapor into your mouth, into swallowing, into your lungs, it has to go through your throat to go into your lungs. It has to pass that way. And you are intending it to go past your throat to get into your lungs. So it has passed into the 𝗕𝗹𝗆, through your intention. Argument is that, look, hang on, we do miswak, and when we do siwak, there's a bit of chemicals from the siwak that go down your throat. And there's a small amount, just like there is in an inhaler, a small amount goes down your throat. So surely, that it doesn't invalidate your fast. So what's the problem? The answer there is because when you do miswak, you don't intend it to go down your throat. That's not the order intended. But inhalers, you have to consciously intend it to go down your throat. And that's the reason why. Endoscopy, gastroscopy, if you put a camera down in your throat, into your stomach, this is a hypothetical discussion in the fiqh book, in particular the Hanafis, you put a string with meat on it, hypothetically, if you were able to do this, down the throat, into the stomach, and pull it back out again exactly as it was, with no remnants remaining in there, it would not invalidate your fast. Okay, that's the Hanafi position, and in fact, the majority of the other madhahib would take on that position as well, but because it's explicitly mentioned by the Hanafis. So for that reason, putting a camera inside into your stomach does not invalidate your fast. The reason why that invalidates your fast is because of the gel they put on it, which remains there. It's a remnant that remains in your stomach. and that invalidates your fast. Lighting incense does not invalidate your in your fast, but it's dislike that you go up to and keep inhaling it. Yeah, nose spray, nasal spray does not invalidate your fast. Invalidate your fast unless it goes past your throat. Then it does. Best avoid it because there's a chance it may go past your throat, but it generally does not. Smelling food, perfume does not invalidate your fast, but it's advised it's makruh, i.e., to do that intentionally. It's disliked. Smoking, yes, it invalidates your fast because when you smoke, you inhale the smoke, and it is going past your throat into your lungs, and some of it goes into your stomach as well. So that invalidates your fast. Toothpaste, mouthwash per se does not invalidate your fast. However, if it does pass into your throat, it will invalidate fast. So you are recommended not to use toothpaste. Not only that, it's got a flavoring and it should be avoided, really. So it's disliked to use toothpaste. However, it won't invalidate your fast. It'll only invalidate your fast if it passes your throat. So therefore, be cautious, don't use it. Eardrops, you can brush your teeth, with a wet brush, not with toothpaste, sorry. Eardrops don't invalidate your fast. They only invalidate your fast when you have a ruptured eardrum. Then it can get in there and it can go into your canal down into your throat and into your stomach. Hence, some people can taste eardrops at the back of their throat. That doesn't necessarily mean that you've invalidated your fast, by the way. It's only when you know consciously that it's gone down your throat that it would invalidate. And that's an important point to take as well. Eye drops, same thing. Eye drops, same thing. Put eye drops in. Sometimes you can taste it back of your throat, but they are permissible. They don't invalidate your fast unless you feel it going down your throat, which is very unlikely with eye drops. So they don't invalidate your fast. Sublingual GTN medication, because they're just absorbed at the lining of your inner mouth. For that reason, they don't invalidate your fast because there's no patent open passage that goes to the gut. Okay, so it doesn't invalidate your fast. Urogenital, anal suppositories, examination, colonoscopies, they will invalidate your fast. You putting a camera up there doesn't invalidate it, but because you got gel on it and you put it up there, it does, because there's remnants of the gel that remain in there. Anything above the rectum in the anal area will invalidate. Suppositories, anything like that would. Even examinations, because they put gel on their fingers before they examine you, that will invalidate your fast. Vaginal and urethral examination. So even in the books of fiqh, some books, they said it invalidated your fast. But there is a principle behind that, because at that time there was an understanding that they were connected to your gut. Now we know in anatomy that they are not. So for that reason, they do not invalidate your fast. So vaginal pessaries, urethral examinations, pessaries and pads and things like that, they do not invalidate your fast. Okay. Catheters, cystoscopies, again, they do not invalidate your fast. Circulatory extracting blood, cupping does not invalidate your fast because you are releasing blood, you're not giving blood. Okay. In nutritional IV fluids, and blood transfusion, there are a lot of scholars who say it don't invalidate your fast. My personal opinion, and I've done quite a lot of research in this, you can get hold of my kitab on this book, on this subject. You can see the detail I put in there. According to me, it invalidates your fast. You should not be having blood transfusions and you should not be having IV fluids. If you are and you're compelled to, then you are usually quite ill, and that's the reason why. So you're excused anyway. Okay, so you're excused, just make qada, but according to my understanding, it invalidates your fast. Yeah. Dialysis, the same thing, it invalidates your fast, whereas you have a number of scholars who say it doesn't. So that's a difference that you need to go by whose opinion you trust in that sense. Okay, so that's majority of those questions. I know the time has gone over, but I'm willing to answer a couple of questions if anybody wants to ask any questions. Okay, let's go back. Oh, there's some really interesting questions here. 1 second. Okay, I get migraines with aura that can stop my functioning. I broke my fasting for 15 days last year. trying to make up this year. If I fast 2 to 3 consecutive days, I get severe pain. I am still trying and will try to fast. Yeah, so trial fast. And if you find during trial fast, during the month of Sha'ban, that you are not able to, it's causing issues. You're just not able to, you're not coping with it at all, then you will be excused. Try to fast as much as you can, though. If you can, do try to fast. But you have to make qada of these fasts, unfortunately. You can't do fidya. It'll be qada. Because migraine is a self-limiting condition. It's not for the rest of your life. For vapors, would the water vapor from humidifier count as an invalidator? No, it won't. Yeah. Because it's not, as long as it's not visible. If it's visible as vapors that appear, quite clearly white and visible, and there's a whole body around it, okay, in terms of its visibility, then it will. So Hafiz Irfan saying, I am from India, Kashmir. What you talk about, Tarawih 20. SubhanAllah. I'm not even going to go into that discussion, inshallah, because that's not the remit of today. There are other sessions that will be coming up there that will be discussed in a lot of detail. To continue the picture, I work at the hospital for a week, and this could be debilitating at points. I know I can break the fast if needed. What about qada? So if you are working in a hospital, let's say you're a surgeon and you're working through your surgical procedure. Now, you need to really think about this carefully. Is it debilitating you to that degree that you can't focus and concentrate, and there is the possibility of harm to the patient? Then you should, and clearly you're in an operating theatre, then you should, clearly break your fast because of the harm you could cause somebody and the litigation against you as well. So there you are excused from breaking the fast. You need to do qada of that fast though. Okay, and you need to stay in a state afterwards whereby you try to eat and drink the minimum to keep you going. Okay, that's the important thing. That condition is related in the sense that you should try and not have surgical lists in that time. Yeah, during Ramadan. If you're a Muslim doctor, you should avoid having heavy roles during the month of Ramadan. That's your role. You are accountable to Allah for that. Okay. There's another question. My question is about one who has sleep apnea and uses CPAP machine at night and Fajr time enters while they are still asleep with the device on. Does it break the fast? CPAP machines, now I know they are attached to humidifiers or not humidifiers. If they are with humidifiers, I would avoid them. Especially if a very visible vapor appears because of that, because you're intentionally inhaling that as well. So you should avoid that with the humidifiers, ideally. Noor is asking, the problem with my migraine is that it is getting worse, not better. I am 47 and getting worse. It's a self-limiting condition. It's not a permanent chronic condition that will last for the rest of your life. You would have to make up for that, for those fasts that you're missing. Try to fast as many of those days as you can. If you can't, then you're excused. But you try to make qada as much as you can in the shorter days, if that helps, in winter months, etc., if you're in the UK and places like that. Otherwise, you would have to make up for them later on. But there is no fidya for that. And, you can take other advice to prevent, the migraines and triggers and things like that. That's medical advice that you can get from relevant places. Okay, so hopefully that's been really helpful. We got a couple of questions here on Q&A. Let's really see if I can address some of these questions. If I miss my salah, does it invalidate the fast even if I make it up later? For example, I miss Zuhr and then pray Zuhr qada. No. Backbiting, lying, missing your salah, fard salah, it does not invalidate your fast. You are sinful, not because you've invalidated your fast. Scholars do say that it depreciates the value of your fast. Yes, but it doesn't invalidate your fast. That's a simple answer to that. But you should avoid all those things. What if someone puts some food into their mouth to taste while cooking and then spit it out? Does it invalidate the fast? The hadith related to this, that if you need to check the saltiness, and this is only for the woman or the person who's cooking, that might be a man as well, that they need to just taste it, just to check the, the quality of the food in terms of, the saltiness, etc. And there's no other way of knowing that. Then they can, at the tip of the finger, they should try to avoid doing that, really. But if they need to, because it's their job role, for example, they can do it at the tip of their tongue and spit it out, wash it out, in that sense. Then it will not invalidate the fast. Because you're just tasting it, you're not actually taking it down your throat. So, Shaykh, could you please give some examples of forgetfulness that will not invalidate the fast? Okay, so you woke up in the morning, and you brushed your teeth, swallowed it here and there, had breakfast, and mid breakfast, somebody came in and said, "You're fasting." Oh my goodness, I'm fasting. Right? It will not invalidate your fast. You stop at that moment, rinse your mouth out, and you continue fasting. That's forgetfulness. Okay. Faiza Mia saying, which category would a person be in suffering with a hiatus hernia, which causes daily pains and fasting is very difficult? Hiatus hernia in itself is not problematic. It's symptomatology. You got some people who have hiatus hernia that have very few symptoms. You have some people who have gastric symptoms which are very severe. So you need to go to you need to assess that and trial fast. See if you trial fast and you find that you're getting severe pains, severe heartburn, making you vomit, then you would be excused. If you're tolerating some element of heartburn, etc., through the day, and it's not severe enough to prevent you from doing certain things, or it's not going to get worse by you fasting, then you should really fast. Okay. Then the question: can you fast if you are a diabetic? Can you fast part of the day and feed a hungry person each day? Doesn't make a difference with you. Fasting is fasting the whole day. You can't fast half a day. You fast the whole day. Yeah. It doesn't count. So, and you need to be very careful how you do that as well. If you are a diabetic, I discussed that already, so I don't know whether you missed it. Listen to the recording. You need to decide, are you high risk diabetic? Are you moderate risk? Are you low risk? High risk, clearly you're insulin dependent, type 1 diabetic. You've had a diabetic ketoacidotic attack. You should not be fasting. That is very dangerous. Okay. Moderate risk, that okay, you've had a number of hypos in the past when you fasted, then you are a moderate risk. Then you are to some degree excused. Okay, but you take advice and what you should be doing. Low risk, then you should be fasting. Okay. What if we don't have control on rota for on-call duties, being doctor in Ramadan? We still try our best in making suhoor or breaking fast. Yeah, you try to do as much as you can, as best as you can, but you're in a situation where a lot of people can fast and they carry on doing the job they're doing. Honestly, people do it, and it's not unusual. It's not immense hardship that it's well beyond your ability to do it. If you're in a real situation, you're feeling really weak, you've lost concentration and focus, and you really think it's going to affect patient care, and it could be detrimental legally as well, then you are permitted to break your fast at that time. Okay, but other than that, you're not really. So you need to be cautious on that point. Okay, right. Alhamdulillah. Swallowing saliva invalidate the fast? No, it doesn't, because it's arduousness, hardship. So it's excused. Okay, but don't intentionally swallow, because that's makruh. Yeah, it's disliked. Alhamdulillah. Hopefully that's been very beneficial. Our time has run out. So, inshallah, please do listen to the recording if you came late. I know many of you joined later on, and hopefully it's beneficial. Remember me and my family in your du'as and Al-Balagh Academy, and inshallah we will remember you in our du'as. May Allah subhanahu wa ta'ala accept our Ramadan and make us amongst the khusus min khusus, like Imam Ghazali says, those who are connected immensely to Allah subhanahu wa ta'ala in such a merciful month like the month of Ramadan. May Allah protect all our ummah around the world, in particular Gaza and many other places around the world where Muslims are undergoing many, many different tests. The shayateen work very hard during Ramadan as well, And without doubt, there's going to be many, many atrocities going around in the Muslim world in a time like this, because this is a great test. And our role as believers is to do the best that we can do, turn to Allah, do istighfar for our own sins as well. And at the same time, for the dua of those innocent people around the world, may Allah help them in all their predicaments. And may Allah subhanahu wa ta'ala accept our hardship through the month of Ramadan and make it a blessed occasion for all of us. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.